COVID cases go up and down and then up again as variants of the coronavirus continue to spread. For healthcare workers, patient care involves a complex and evolving set of treatment options. Hospital workers are the glue in our public health system. And during the past few years, healthcare workers have shouldered the brunt of the crisis. The burnout, the lack of resources, and even the illness itself. But now, some are moving beyond the bedside to share their medical expertise with a much broader audience. From West Virginia Public Broadcasting and PRX, this is Us and Them. It's the show where we talk about the things that divide us. I'm Trey Kay. This is not the first epidemic for modern healthcare professionals.
A mystery disease known as the gay plague has become an epidemic unprecedented in the history of American medicine.
Acquired immune deficiency syndrome.
Federal health officials consider it an epidemic, yet you rarely hear a thing about it.
4 decades ago, AIDS was the scary, unknown disease. In the early days of that epidemic, medical researchers had to create new treatments and medications. I see one major difference between then and now: social media. So much about how the COVID pandemic has played out has been defined by that constant fire hose of information and the rumor-based fear-mongering. I've been wondering what it's like to have worked during both crises. So I called Dr. Wes Ely. He's an ICU doctor and professor at the Vanderbilt University Medical Center in Nashville, Tennessee.
The coverage of the HIV crisis was there, but it was almost veiled, and the public didn't want to know about it, didn't want to hear about it. They were afraid of it. It was covered from time to time on the mainstream news and newspapers, but nothing compared to the degree of now. People could go days and weeks without really thinking about HIV, but you can't do that with COVID. Having gone through SARS and MERS, we knew it was coming because you can't deny epidemiology. And the anticipation of it was a bit scary because we didn't have a vaccine, and you're wondering, am I going to get this disease and how can I prevent it? It was a great anticipation. And the other thing that I really want to mention is that we were nervous for our families, because I, for example, take care of a Down syndrome 58-year-old brother-in-law and my wife, who's a pathologist, and they weren't going to be around COVID in the ICU, but I was going to be coming home every day. And so we had to really grapple with, am I going to live in a hotel? Am I going to live in my house? Am I going to isolate into one room once I get in the house? And that was just kind of complicated, you know?
Dr. Ely says his most vivid recollections of the first wave of COVID were the packed hallways at his hospital.
And us just going from bed to care for these patients who were so just immensely ill, sucking for wind, sweating, unable to communicate to their family members well, very delirious. It was very nightmarish. And yet it was almost like Groundhog Day, where every single day just kept going over and over and over.
Then one day, Ely started getting calls from fellow ICU doctors around the world. They were all caring for patients with this new mysterious virus.
And they were saying, Dr. Ely, we're seeing a tremendous amount of delirium and we're seeing all this brain dysfunction. Why don't you get on Twitter? And if you get on Twitter, we can launch an international study of delirium or brain dysfunction in COVID. And I said to them, I'm gray haired, I'm old, I don't do social media. But they talked me into it. And I got on Twitter and it was amazing. In 2 weeks, we enrolled 2,100 patients into our COVID-D, which is COVID delirium study.
Wes Ely is a critical care specialist who spent his career designing medical studies. That first experience with Twitter showed him an unexpected silver lining on the power of social media. But that wasn't all he found online.
Once I was on Twitter, I started then seeing all this stuff out there about ivermectin and promoting these anti-science tropes. And I was like, wow, this is crazy. Why are they saying this stuff that's not true?
Ely did not expect the growing ecosystem of disinformation. Many social media posts criticized effective, old-school public health measures, stuff people were doing 100 years ago during the last global pandemic. Masks, social distancing, and vaccines.
This has been engineered in the media to create massive amounts of fear.
It's hard to disappoint all you doctors out there, but the ivermectin is still working really well.
I'm not a medical doctor. I'm not telling anybody to drink their own urine, but I drink my own urine. I've drink my own urine for the last 23 years, and I'm still alive.
I kind of backed into it by trying to do something good for science, and it worked that way, but then it exposed me to social media where I had not previously been exposed. And so by June of 2020, I was shocked that this was happening.
That feeling only increased as Ely spent more time online.
I know vaccines. I've studied vaccines for 23 years. This vaccine is the worst bioweapon I've ever seen.
This is vital information. It really needs to get out, and I know people are sharing it. Just keep doing that.
This is Armageddon. This is the final battle. We need to win this one.
What are some of the greatest hits of the things that have shocked you?
Some of the greatest hits were that even after we randomized hydroxychloroquine to placebo and showed that the survival curves were superimposable, meaning that the placebo did exactly the same thing that the drug did, so therefore it doesn't work, people still kept propagating this myth that this hydroxychloroquine drug would work for COVID. And I was like, wait a minute, we just proved to you it didn't work, and you're not accepting this as truth. And then the same thing happened with ivermectin. That was something very unusual for me, because we can tell what is a good study and a bad study. For example, if I make you a hamburger and a filet mignon sitting right beside one another, and you're a meat eater, and I tell you that the hamburger is the filet, you're going to say, well, no, there's the filet, and I can cut it with a fork, and it's beautiful and amazing and tender, whereas this hamburger is just chopped beef. It's no good. You know, there are studies that are hamburger, and there are studies that are filet, and these people are trying to make a hamburger into a filet, and it's not.
Why do you think these narratives have taken such a deep hold? These hamburger narratives, if you will.
I think that politics entered into it. You know, it was funny that it occurred right at the time when we were having a changing of the guard of the political parties. And so people had kind of become entrenched. Our country became very, very partisan. But that's not all. I had one patient come to me, and she was crying. She was in the ICU on oxygen, really suffocating. And she started crying, and she said, Dr. West, do you want me to tell you why I didn't get vaccinated? I knelt down, and I looked her in her eyes, and I held her hand. And she said, first of all, doctor, would you please tell my family to get vaccinated? And I said, absolutely. She goes, I was wrong. I made a mistake. And then she said, let me tell you what happened. I was watching TV, and a congressman on TV said that they were trying to depopulate society of people like me with the vaccine. And I believed him. She was a victim of misinformation propagated on the TV about this being some form of eugenics, which the vaccine is not. And that makes me feel compassion and empathy.
As Ely treated more and more COVID patients, he started to observe a new factor, one beyond medical symptoms. He found that his patients' information diet could play a role in their condition. It's easy to forget the confusion over COVID information early in the pandemic.
Initially, we didn't know that masks were going to be so effective. And even Fauci said it's not about the masks, but it did become about the masks. And then when public messaging became about drugs like hydroxychloroquine and ivermectin, which don't work against this virus, that was frustrating. But once it got out there, we had to prove it. So you then had to design randomized controlled trials to say that they didn't work. So you've got people going towards something that's not working and going away from something that is going to work. And that was really frustrating, because each direction was exactly the opposite direction of what was successfully going to control the spread of the virus.
Researchers have proven that most online COVID disinformation can be tied back to a handful of accounts. That comes from the Center for Countering Digital Hate, an organization based in the UK. A 2021 report highlights what they called the Disinformation Dozen. Dr. Wes Ely says people he knows have gotten on the wrong side of science.
I've been in medicine for 30 years, and it's never been this egregious, and it's also not been propagated by fellow clinicians. There are people that I trained with and worked with for 20, 25 years who have been respected people in the community of medicine who have been promoting ivermectin and anti-masking policies. And I don't know why they're doing it other than maybe ego or fame or maybe money. But it's been really frustrating to see friends of mine actually jump on the wrong bandwagon and I think place people's lives at risk.
Have you tried to engage with those friends?
Yes, I have. And generally, they have not been willing to engage back and forth with me. I don't know why all of a sudden they chose to buck a universally standardized approach towards reading papers, analyzing them scientifically, and then calling out truth. That's what we're trying to do, but they are actually focusing on untruth. And that is not the way we do medicine.
COVID convinced Ely he needed to do more than just treat the patients in his own hospital.
As I was grappling with this idea of Twitter, I thought, what if I could play a small part, a widget, in spreading love and science? And that is what I've tried to do, is say, I'm going to spread good science and true analysis of these studies to point out what's hamburger, what's filet, and also spread love.
So he started posting more. First to Twitter, then a colleague had another idea.
And she said, Wes, you should consider going on TikTok. And I said, no, there's no way. I mean, Twitter was enough. There's no way I'm doing TikTok. And she goes, no, it's a whole different audience, and you could just make a 3-minute video and post it and see what happens. So I just sat in my office and I just opened my iPhone up, flipped the camera around, and just talked into the camera.
Hi, this is Dr. Wes Ely from Vanderbilt. I'm an ICU doctor.
And it got like 80,000 views the very first day. I was like, wait a minute, what? That's crazy. And so then I just started generating them.
Hi, this is Dr. Wes Ely. Hey, folks, this is Dr. Wes Ely. Hi, this is Dr. Wes Ely. And I just want to make a few comments that might be helpful to you about masking, booster shots, post-intensive care syndrome. Let's talk ivermectin.
A lot of his videos are basically public service announcements. Nothing fancy, a few minutes long, talking about specific aspects of the virus and medical response. Others are like mini documentaries from the ICU. In one video, Ely and his patient grip a paper covered in tiny circles. The woman's breathing tube matches her hospital gown. You can't see her face, just a single French manicured thumb. But you can almost hear her thinking, trying to connect the dots while Ely explains what's happening.
She has a hard time reaching because she has weakness, so I'm doing the marking while she points to where to go. And we can tell by how long this takes whether or not someone is having difficulty with their executive function, which is part of the post-intensive care syndrome. After having received lots and lots of medications, the brain will not be quite as sharp and quick.
So from J, you want to go to a number. So what's the next number after 10?
There we go.
In another of Ely's TikTok videos, a man lies in a hospital bed. He looks very sick and scared.
I made a mistake by not getting the vaccine. You can look at me now and see that I have COVID pneumonia. If I had my vaccine, it might not be this bad on me. So I was stubborn. I'm just like a lot of people. I'm stubborn pride. And because of that, you see what's happened to me. Don't let it happen to you. Don't let it happen to you.
It's a moving video, and there's a potential irony to it. At a time when many people have been convinced against the vaccination by social media, Dr. Ely's patient ends up with 60,000 views for his TikTok mea culpa.
Those are also some of the ones that got the most controversy about the vaccine because people are very emotional one direction or the other.
Ely always gets written releases from patients or their families to include them in videos. And the hospital knows about the project too. The public reaction to his content is revealing. On TikTok, you can watch a person's video and leave a comment. The number of comments helps determine the video's popularity. Dr. Ely's comments section can be a bizarre mix of well wishes and mocking. One viewer jeers, "I wonder who he voted for." Another comment makes the false claim the patient was paid by the government to endorse the vaccine.
The ones that are almost universally well received are like a post I had about Flo. Flo was a woman who was dying of heart failure from lung disease. And I do this often with patients at the end of their life. I say, do you have 3 wishes? I want to grant you 3 wishes. And this was started by a famous doctor, Deborah Cook in Canada, in Toronto. So Flo said, I haven't had salt in 3 years, so I'd like to have a pizza. My son is having a birthday, and I want to stay in the hospital 1 extra day so that I can not go home and die on his birthday, because she's probably going to die the day she gets home. And then I'd like to have more than the allotted number of family visitors. And so we expanded family visitation. We had the family in. And then as a 4th bonus wish, we bought this huge birthday cake. And instead of the son and everybody coming in and just having time together with a pizza, we did pizza and this huge birthday cake and had a whole birthday party. And when I posted the videos of that and the 3 wishes, people went crazy. People were like, this is it. This is what matters. And those sorts of videos, and I've done quite a few like that, make people realize that, yes, we're in a pandemic. Yes, we're hurting. Yes, we're burned out. But at the end of the day, eye contact, human connection, and love between one another, that is the universal key that unlocks what this is all about. And so I'm going to keep doing those whenever possible.
And I can imagine your social media posts get a very different response from viewers.
The ones that I've seen get the most negative feedback are the people who didn't get vaccinated, got COVID, came in and were ill. And yet both of these people have an end-stage illness that's likely to take their life. They're both human beings. And yet Flo gets universally well received with her 3 wishes. And then I make up a name, John. People are mad. And they think that they even said sometimes you've manipulated the story, you've made this up. No, I never have done that. It's always been completely authentic. But you're right that this has been received differently because the disease of COVID has been politicized, and people, I think, carry into their reaction their own camp, where they've been encamped in one camp or the other. And what I'm trying to do with this social media is get rid of the siloing of the us versus them and say, no, we're all in this together.
Nearly 80,000 followers later, Dr. Ely is on a mission.
I think that what you're seeing is across science is that some of us are saying it's not enough just to be scientists right now. Society is in need of hearing from us because we see some things that the general public don't see. I mean, I never in a million years thought that I'd be on TikTok. But this is unusual that doctors and nurses have taken to the streets, in a sense, to be, in a sense, activists.
The internet is clearly reinventing how we talk to each other, and it continues to shape our views on COVID. Dr. Wes Ely and some of his colleagues are at the heart of a new story that's just unfolding. Their social media platforms are here to stay, at least for now. So, for those looking to fight disinformation, what does good crisis messaging look like in 2022? After the break, a new kind of Hippocratic oath and the debate over what that means. You're listening to Us and Them. This program is supported in part by the West Virginia Humanities Council, the CRC Foundation, and the Greater Kanawha Valley Foundation.
Music lifts us up and brings us together, even when we can't get together in person. Mountain Stage brings you live performances on the air, online, and in our podcast. They remind you how it feels to be in a live audience listening to live music. This is Larry Gross, host of Mountain Stage. Find a link to our stations and our podcast online at mountainstage.org.
Hey, it's Trey. And a quick heads up, this half of the show will mention suicide and mental health struggles. From West Virginia Public Broadcasting and PRX, this is Us and Them. The challenge to conquer COVID has many angles. A continued push for new treatment options is vital, but it's also a battle over messaging. Melissa Fleming is the Undersecretary General for Global Communications at the United Nations. It's her job to talk to people about big, difficult topics.
In the COVID-19 context, in the Ukraine war context, even in the climate change context, we really are fighting an information war.
Tell me what you mean when you say that.
It is a battlefield because it's killing people. If it's in the COVID-19 front, it's killing people because it's leading them astray. They're ending up in ICUs because somebody convinced them that getting a vaccine was dangerous to their health, and instead they're dying. States are disinformation actors and are using the airwaves to deliver their particular narrative. Individual disinformation actors are trying to convince people vaccines have chips in them or other crazy things. And then there are the people who are just consumers and maybe inadvertently becoming part of the problem because there hasn't been the media literacy. They didn't grow up learning how to navigate this crazy media landscape in school, so they're maybe just wanting to do some good even and finding, wow, this new cure is really interesting and sharing it further. And then another 1,000 people are reached. And then that person who I trust just shared this, so I'm going to share it again. And then another 1,000 people are reached. And it's like, in a way, it's kind of digital telephone. Then it starts becoming the truth.
When COVID was first discovered, Fleming worried institutions like the UN were not up to the fight.
I've always been struck at how terrible public institutions generally are in communicating science. And in the public health field, science shifts and science has nuance. And we just thought that we really needed to be in those spaces where people were getting most of the misleading disinformation and misinformation, to position the UN as a trusted source of information, but not one that was in its typical form of the PDF document on a website that people have to search for. We did this experiment called Team Halo, where we trained 100 scientists around the world who were really unknown, working in labs, developing the vaccine, and convinced them that they're actually quite dynamic and charismatic in their small circles of friends. But we allowed them, also with the help of TikTok, to verify their accounts. We trained them on how to successfully communicate on TikTok. And they developed followings that really did compete with the worst of the disinformation actors.
And that was the beginning of something relatively new in the world of public health. An intentional effort to encourage people with expertise in medicine and infectious diseases to take to social media. Dr. Siab Panwar is one of those scientists. He's a cardiologist based in Louisiana. Unlike Dr. Wes Ely or Melissa Fleming, Dr. Panwar grew up on the internet. Before COVID, he was already comfortable with social media, where anybody has access to celebrity and the trust of strangers.
You can play to people's emotions. And if you can successfully play to people's emotions, the facts don't matter anymore. That kind of stuff is incredibly hard for me as a physician to debunk. So if I see a video that's obviously misinformation or wrong, I'll take part of it and I'll break it down. I'll say, listen, this is what this person said, and this is exactly why this is wrong. For example, the vaccine goes into your body and stays in your body parts and organs, and that's a very scary piece of misinformation that's been going around for a while. And I'll make a video saying this is why it's wrong. A lot of the times they'll use official documents and scientific papers to try to prove their point or say that, oh, look, I was right all along. But I'll take that same argument or same paper or same document and say that, listen, this is what they're trying to tell you, but they didn't read the whole paragraph, right? Or they didn't tell you this part. This is how they're misinterpreting. And a lot of the times I think that's very effective because then people can see it.
Panwar has a big platform, more than 400,000 followers. That's forced him to think carefully about how to use this power responsibly. Scrolling through his TikTok posts, you might meet this Dr. Panwar.
Hey everybody, so some new Pfizer documents have been released, and as expected, all the anti-vaxxers are up in arms about it. Let's talk about it.
Or this guy.
You know, I've seen a lot of dumb shit from the conspiracy theorist anti-vax camp over the last couple years. But when they do this kind of dumb shit takes the cake for me.
I'd seen lots of posts from medical professionals before talking to Dr. Panwar. They were all meant to dispel disinformation. Many come off like friendly neighborhood public service announcements. But some take a more aggressive approach. They publicly shame disinformation spreaders or even try to get them fired.
They will sort of engage in sort of like ad hominem attacks, sort of like try to attack the person itself that's making it. I don't do that because I don't think that's effective, and I don't want to make more enemies, right? Because I don't believe in doxing and all of that. And there is a whole dark side, by the way, to this whole thing that goes on that people don't know about. So I try to stay away from that because I don't honestly need any trouble. The majority of my comments are nasty comments from people that call me anywhere from, a pharma shill, paid pharma shill, Team Hilo agent. I've been called a communist spy, Chinese agent. I mean, all sorts of things. Obviously, there's been some racism as well because of the color of my skin. So the dark side, what I was referring to was the idea that, we put ourselves out there. I try to anonymize myself. I hide my last name, but anybody can Google me and find my name, where I work, all my publications, etc. Kind of easy to find, which is a bane and a boon. It's a boon because, people look me up and they think, I have the credentials to sort of back up what I say. But it's also a problem because they can, if they don't like me, they can try to report me to my work. They can try to report me to my medical board for what, I don't know. But people that want to harm you can harm you.
Panwar's content feels somewhere in between this us and them approach to COVID information, between simple PSAs and aggressive call-outs on disinformation. He's avoided the worst of what can happen to social media creators. For example, he's never been swatted. That's when people find your address and send law enforcement in the hope of causing you trouble. But Panwar is friends with people who have dealt with that and still think a more aggressive response can be effective. People like Jared Vincent.
I am the dictator of the House of Petty, and you are blessed to meet me.
And is petty is petty a name, or is petty like
it's an expression of who I am? Not only is like who I present to people online is who I am in real life. I'm a petty bitch, but that's how I operate. And I get in trouble a lot. I get a lot of coaching on professional uses of words because if you're acting like an idiot, I'm going to call you it. There comes a point where education just isn't stopping, and it's actually like egging them on. Many times on social media, if you attempt to debunk somebody, that's actually what they want. They want to feed off of that. They want to catch you in something. They want to do it. So if you don't shut it down immediately and broker no discourse, and you are wrong, and what you are doing is hurting people, but you do it in a fabulous way, it gets it done.
Vincent is not part of Team Halo, but he was working as a nurse at the start of the pandemic. Since then, he's taken his passion for healthcare to TikTok and gained over 500,000 followers along the way. He says a lot of times when somebody gets called out, they'll delete their videos and wipe their accounts. This amounts to waving the digital white flag. The word that describes this kind of exchange for me is vigilante.
I wouldn't consider myself a vigilante. I would consider myself holding somebody accountable to our implied trust with the public. Because a vigilante is somebody who is getting revenge. And I would consider myself a defender. I don't go out and try and find somebody, okay, and find somebody to take down. I don't go on the internet and look for, that one, racist old guy. My followers come to me and say, can you help me? Like, this is scary. Like, what does this mean? And then I look at it, and I look at the whole account, and I say, well, where are they coming from? Like, can I meet them where they're at? Or do I need to bring out the dictator of the House of Petty and put a stop to it immediately? Do I need to get red lipstick on, or can I just eat a sandwich?
This kind of content really embraces the divides between us and them. Aggressive videos tend to be popular, and they boost engagement, which drives profits for social media companies and advertisers. But Vincent says that's not why he does it. He's frustrated by how our institutions have approached COVID messaging since day one. And the words he uses to describe it?
Ignorant, ill-prepared, defensive. Their ill-preparedness bred ignorance and bred defensiveness. Social media is not just, it's not press, okay? It's not a newspaper that you can open up. It is a series of images and a ding, ding, ding of an emotion. And with those emotions, you want to get words stuck. It is a mathematical equation on a battlefield of the mind, okay? And you have to be able to get your point across within a short amount of time that sticks with somebody. Then they interact with it, and then it solidifies it.
Those are the same algorithms that encourage conflict and convince people to use potentially dangerous so-called treatments.
It is chess. And when they set out their first move, you need to be able to move yourself in the front line so that everybody behind you is protected. There was dangerous things online that, sometimes I would pull in, the science creators that I helped build a very large platform. And I was like, listen, this needs to stop. This needs to get off this platform now. And that was when people were nebulizing hydrogen peroxide and they were giving it to kids. That is unbelievably dangerous. And there were people who were not doctors who were showing parents how to buy nebulizers and give nebulized hydrogen peroxide to children. Okay? No. I made sure that they could not come back on that platform. There are certain things that you should just not have available to the public.
Since 2009, I kind of got into the reporting that I do is looking at the culture war divide. And one of the things that I feel like I've heard is that there is a side of Americans who feel like another side of Americans are not listening to them. And my approach has been in many ways to people who I disagree with, who I don't understand. I don't understand their politics. I don't understand their religion. I don't understand the various things that motivate them. If there's a way to make a connection some way, is for me to at least listen to them and to honor them. As I'm listening to you, I can see why and how my approach is effective in the long range. I'm not sure your approach is effective in the long range.
We don't have time to hold your hand, because what you just explained is probably the most dangerous mindset in the middle of a global crisis, which is we've got to talk, we've got to listen to both sides. While people are literally being burned in pyres in India, 5 million people dead, we want to have a civil conversation? No. Not only are we having a global crisis, not only does that mindset leads to complacency, that leads to think that this is an emergency. And while the world's burning down around us, there needs to come a point where this needs to stop. Yes, sometimes my posts were very confrontational, but it wasn't because I wanted to hurt them. I was defending the people that they were hurting.
Jared's sense of urgency is closely tied to his experience as a nurse caring for COVID patients, especially early on.
My peak COVID was when I was in Arizona. The day that broke me was the day that I pronounced 16 people. 16 people died, which led to a mental break where I attempted suicide.
That's when Jared's license was put on probation, and he entered mental health treatment. He sees a direct line between that experience and his decision to start posting online.
One of the reasons why my suicide attempt was so vicious towards myself was because of my childhood. You know, I had a really bad childhood, and I don't want to see people taken advantage of. I needed to fix something because everything was so broken around me. I think nurses right now, we've been so broken. There was so much pain and death going around us. People didn't have good death. We didn't see good death for 2 years. We saw fear. We saw a breakdown in the natural order of dying. Nurses weren't prepared for that. And if I had an opportunity to fix what happened before, then I'm going to do it. And it's going to suck, and there's going to be nights that people are going to attack me and threaten me. That was worth it. That's what nursing is about.
Remember Dr. Siab Panwar? He's the cardiologist in Louisiana. Well, he told me something similar. People say he's made a difference for them.
I've gotten probably 200 messages at this point since I've started my TikTok journey from people saying that they were hesitant or they had a lot of concerns or they were afraid, but they watched one of my videos and that convinced them to go get vaccinated, or they forwarded my videos to other people. I've even gotten messages saying that I showed your video at my school board meeting about masking. So, so my work, and this has sort of been crazy, is that my work has sort of reached way more people than I ever thought it would.
Siab and Jared are friends. They met through TikTok and sometimes disagree on how to manage their accounts. Everything from what messaging works to how to handle commenters who are spreading disinformation.
Some of my friends and colleagues that do videos as well, they have a whole list of people that they've blocked. So their comment sections are sort of curated, right? Because they will individually go and also delete comments that are misinformation. And that's the way they do things, and that's completely fine. But the way I do things is my comment section is essentially a free-for-all. You can come on my comment section and you can curse at me and I won't block you or I won't delete you. And to me, that's very important. Number one is because nobody can accuse me of, suppressing their right to free speech. Secondly is because when they do that, it gives me an opportunity to rebut them. I think at the end of the day, the challenge is to have a discourse where nobody feels like they're being silenced, and you're still at a point where people are not being harmed by misinformation. But we don't live in a world like that, unfortunately. The reality is that there is stuff like that that's out there, and people listen to that. Do I think that getting somebody fired, or do I think that getting Joe Rogan deplatformed, do I think that that has any sort of meaningful effect long-term on this? I don't think so. I think that education is probably the most effective way to get people to do the things that we want instead of force.
Some critics of COVID vaccinations have been kicked off social media platforms. Take Dr. Robert Malone, a prominent vaccine critic who claims to have invented the technology behind the mRNA vaccines. Twitter shut down his account for violating its COVID misinformation policies. Since then, Malone says he makes tens of thousands of dollars monthly in blog subscriptions and markets himself as a victim of social media censorship. Panwar has noticed that trend among prominent disinformation spreaders.
I think it comes back to bite you in the ass. Sometimes I really do wonder if we had just left them alone in their little corners talking about whatever they wanted to talk about, if you would be in the situation that we are today. Honestly, I think about that sometimes. This is something that I have to struggle with because these are these are polar opposite ideas in my mind, right? I don't want anybody to get harmed by misinformation. I don't want anybody to die because they didn't listen to science and they followed some person on YouTube that told them to go take ivermectin or whatever it was, right? I mean, that to me is just wrong. It's unacceptable. But how do I balance that with the idea of free speech and the fact that people have the right to make their own decisions, right? And this is something as a doctor that I have to tell myself every day and realize that people can make bad decisions.
We're just beginning to understand how these internet platforms are changing us. When we open these apps, I've wondered, what are we really looking for? Information? Acceptance? A good old-fashioned dopamine rush? There isn't one answer, but they all put Siab and Jared at the forefront of an important decision. How much should crisis messaging reflect those desires? Dr. Panwar thinks people will continue to turn to the internet for healthcare information, and that raises a host of other questions. What should the goal of online advocacy be? To inform? To change minds? To punish bad actors? And what cultures are you creating along the way?
This is something that it took me a while to realize, but it was a very important thing that I had to realize, that disinformation, especially when it comes to COVID and the vaccines, is not something that you can get rid of. It's like a lot of chronic diseases that we deal with. Diabetes, high blood pressure, which is my bread and butter. I can't get rid of it. I can just help my patients get better control of it so that they can live long, healthy, as much as possible lives. And it's the same thing with disinformation in the sense that you can't get rid of it. What we can do is address it whenever we see something that pops up. You know, you make a video or you make a post or whatever, address it and tell people why that is wrong so that people have the tools and resources to see why something might be wrong and then make their own choice about how they want to move forward.
That's why Jared Vincent thinks it's time to ask ourselves harder questions about what we should allow online.
To be fair, I think that we got too big for our britches because the internet has created a pipeline for disinformation and misinformation. And what has done that is the hijacking of what is considered free speech. I don't want people to take this. I'm not saying we need to stifle free speech. We need to make sure that what is said isn't causing harm.
Many of the doctors, nurses, and other healthcare professionals who've taken to social media have a basic goal. They want to make complex medical information more accessible and hopefully save lives. It's a vulnerable job to take on. Even online, it seems COVID continues to put healthcare workers into the crosshairs of our country's divisions. At its core, it's a debate over what is the truth and who is credible. Melissa Fleming with the United Nations says social media companies are mainstreaming that debate. That's why many organizations are trying to establish boundaries in hope that social media platforms will make changes.
At the higher kind of macro level, I'm leading a process to develop a code of conduct on integrity in public information, which will be aimed at the social media platforms. We're just doing the research now, but really to pull together the entire UN system's findings, observations, thinking, and make recommendations for how to make the social media space a space that really is serving the public good.
You've been listening to Us and Them. Our team for this episode is me, Trey Kay, Christina Stella, and Kate Smith. Special thanks to Catherine Chapman, Allison Corbett, and Katerina Katiti at the United Nations. Michael Lipton and Tristan Lozow wrote and performed the Us and Them show music. Mark Lerner designed our logo. The marvelous people at PRX and West Virginia Public Broadcasting make Us and Them possible. So do grants from the Corporation for Public Broadcasting, the Greater Kanawha Valley Foundation, and the CRC Foundation. This program is made possible by funding from the National Endowment for the Humanities and the Federal American Rescue Plan Act of 2021 through the West Virginia Humanities Council. Any views, findings, conclusions, or recommendations do not necessarily represent those of the West Virginia Humanities Council or the National Endowment for the Humanities. Us and Them was originally developed with assistance from the mentorship program at AIR, the Association of Independents in Radio. We'll see you next time on Us and them.
Support for this podcast comes from the Corporation for Public Broadcasting.
From PRX.